thank you, Your Excellency and Princess Nazreen, for including us, the Academy of Nutrition and Dietetics, in this year's forum. We are so honored to be here to talk about our profession and its role in the science, particularly application of women. The Academy represents more than 100,000 food and nutrition professionals in the United States and throughout the world. Academy members are primarily registered dietitian nutritionists, and we specialize in applying nutrition sciences to improve all people's health. We incorporate research and evidence into every aspect of our practice. Scientific research is really the basis of our profession, and science is a major component of our educational preparation. As we've discussed here today, the importance of science education, we all must learn biochemistry, chemistry, behavioral and social sciences, which has also been mentioned today, pharmacology, and food management, which is a science in itself. And sustainability has also been mentioned, and this has been much more of a focus of us more recently. Scientific nutrition in the United States was firmly established as early as 1911 with the publication by Henry Sherman of The Chemistry of Food and Nutrition, which again connected food, which maybe perhaps at that time people didn't think of in such scientific terms, with science. This groundbreaking work predated by 6 years the formation of what is now the Academy of Nutrition and Dietetics. Registered dietitian nutritionists translate nutrition science into practical techniques that help people bring nutritious food into their daily lives. We distinguish fact from fiction and science from fad. Again, very important today when the internet is a source of information and misinformation about many things, including food and nutrition. We're the experts in giving people the tools they need to make realistic behavior changes and enjoy a healthy lifestyle. I want to emphasize that research informs every aspect of our work, whether advising clients, interfacing with customers, treating patients, tracking outcomes, or evaluating the effectiveness of new interventions and innovations. In healthcare, the conclusions from this solid nutrition research help inform our ability to improve patient safety and reduce hospital readmissions, leading to better, more effective care and healthier people. Consider just one example of how research can improve health, the challenge of malnutrition, which is certainly a problem around the world, not only in the United States. Academy members are keenly aware of the importance of recognizing and treating malnutrition. More than half of all the seniors in the United States are malnourished, and many of these are not diagnosed. I might also emphasize that malnutrition is not only the emaciated, cachectic child that you might see, but individuals who are overweight, individuals who appear to have no particular problems with their weight might be malnourished. So it's a very complex issue that our members are trying to address. In partnership with Avalere Health and Abbott, the Academy started the Malnutrition Quality Improvement Initiative, or MQII, which actually looked at data from more than 200,000 patient admissions. And with this data, participating hospitals can collaborate across broad-based clinical health teams. So it's not only dietitians, it's physicians, nurses, pharmacists, other healthcare professionals to provide patients with comprehensive evidence-based treatment for their malnutrition. As part of this initiative, the MQII team discovered that optimizing nutrition care for hospitalized patients could result in 27% decrease in 30-day readmission rates, which is a measure that's often used in the United States, and a 2-day reduction in the average length of stay for a malnourished patient. So we're making progress here in the hospitals. We're also making progress in many other areas, but my focus here is to talk about this malnutrition in the inpatient setting. A study at the University of Iowa Hospital and Clinics showed that coding and documenting malnutrition and then actually intervening, which is another thing. It's one thing to identify malnutrition, treating it as a whole other thing, led to substantial health benefits for patients and also resulted in increased reimbursement, appropriate reimbursement from Medicare and Medicaid for the hospital, which allowed them to then hire more registered dietitian nutritionists to provide care to the patients. Again, one example of how applying science to our profession will help improve the health of people in the United States. The Academy is working globally as well, and we have a number of malnutrition and other health-focused initiatives around the world, which we would love to discuss at another time with all of you. We do want to emphasize again that to be a registered dietitian nutritionist requires a bachelor's degree at this time and courses in a wide variety of sciences, including microbiology, chemistry, physiology, but also in business, economics, computer science, food and nutrition science, and food service systems management. We're leveraging the data that we collect through electronic means to make significant improvements in the way we can improve the health of people. Before I close, I did want to mention that diversity and inclusion is an extremely important part of the Academy of Nutrition and Dietetics, that our practice is enriched and expanded by a diverse and inclusive workforce. We have tended to be a female-dominated profession that is changing, and we are working hard to make sure it continues to change. It's a priority to which we devote substantial resources and time. Last month, our board of directors approved a new official definition of diversity and inclusion, which is now going to be the driving force behind our strategic plan for diversity. And the definition states that we encourage diversity and inclusion by striving to recognize, respect, and include differences in culture, ethnicity, age, gender, race, creed, religion, sexual orientation, size, ability, politics, and socioeconomic characteristics in our profession. We embrace the importance of encouraging diverse individuals to enter the profession and also to remain in the profession. We've talked about the challenges of getting people, of women and men, to enter science-based fields, especially women in this case. We want to get diverse and inclusive individuals into our profession and keep them there, and we're working hard to do that. So we proudly serve a critical role in preparing and maintaining the science-based capabilities of diverse experts who, again, are primarily but not exclusively female, to optimize the health of all people. Thank you very much for this opportunity to participate in the panel. It's been my great pleasure to be here. Thank you.
Thank you so much, Ms. Russell. We were just, Princess Nisreen and myself were just speaking about the need for inclusion and diversity to the girls in the other room, and we started a discussion on that. So I thank you for including that in your contribution. And thank you for what you're doing in the field of health, because we need women and girls in science, but we need healthy women and girls in science with healthy families. And it's good also that you've brought up the subject of malnutrition. And never has there been a time when we had so many mouths to feed. So thank you. It's all very appropriate. Thank you. So our next speaker.